Yes, good morning, dear students, and good morning, my dear friends. Today, we are going to discuss about the palm of the hand. So, the palmar aspect of the hand. When you just look at the hand, we are having two different aspects. One is dorsal aspect and the palmar aspect. Coming to the skin of the palm, we can identify the thick skin which is lining the palmar aspect of the hand. Whereas if we just see the posterior aspect of the hand, we can identify the dorsum. There we can identify the thin skin which is lining over there. So the major difference which we can identify on the thick skin is there are no hair follicles are present on the thick skin, whereas on the thin skin we can identify more number of hair follicles. So let us see that the skin of the palm, it is consisting of sweat glands, palmar aponeurosis, longitudinal and the transverse creases we can identify. Let us see what are they. So here we are just observing the palmar aspect of the hand. We can identify the creases. These creases are called as flexion creases of the wrist. We are moving from proximal to distal, so we can identify the flexion creases of the wrist. Then we can identify flexion creases of the palm and the flexion creases of the fingers. So these are different types of creases we can identify. One is transverse creases. These are the transverse creases. One is proximal crease and the distal crease. Coming to the flexion crease at the wrist, we can identify two creases. One is proximal wrist crease and distal wrist crease. Sometimes in some people there might be two or more transverse creases which we can identify at the wrist joint. Then moving to the palmar aspect, means at the palm. The palm we can identify longitudinal creases and as well as horizontal or transverse creases. So the longitudinal creases are radial crease which is towards the thumb, then mid palmar crease. Radial crease, it is also called as mid palmar crease. Okay, so radial and the mid palmar crease, two different creases we can identify. One is radial, which is present towards the thumb, and the mid palmar crease, which is present at the mid part of the palm. There are two longitudinal creases and two transverse creases which we can identify. One is proximal crease and the one is distal crease. Here you can see the radial crease, and this is the mid palmar crease, and this is a proximal transverse crease and the distal transverse crease. Then moving to the distal flexion creases, means the flexion creases which are present on the fingers. So let us see that. So here you can see the distal flexion creases which are present on the palmar aspect of the fingers. Then we can identify friction ridges. These are the friction ridges which we can identify on the distal phalanges. Yeah, there are different types of creases are there, different ridges are there. Some are loops, some are arches, some are whorls. These are whorls, and some are loops, radial loop and ulnar loop. If it is projecting towards medially, that is ulnar loop. It is if it is projecting towards the thumb, that is called as a radial loop. And here you can see the A, it is showing the arches. So coming to the, after removal of the skin, we can identify the superficial fascia of the palm. So the superficial fascia of the palm, it is containing a subcutaneous muscle called as palmaris brevis on the ulnar side of the palm. Let us see that. So here you can see the palmaris brevis, which is present towards the ulnar aspect of the palmar aponeurosis. So the palmaris brevis, which is arising from the flexor retinaculum and the palmar aponeurosis, and it is inserting into the skin along the medial border of the hand. This is the nothing but the palmaris brevis muscle. Then moving to the nerve supply of it is superficial. It is supplied by superficial branch of ulnar nerve. And the action of the palmaris brevis is when an object is grasped tightly in the hand, It causes wrinkles on the medial palmar skin and helps to prevent the ulnar displacement of hypothenar eminence. Yes, moving to the next structure is the deep fascia of the palm. Deep fascia of the palm, first one which we can identify is the thickening of the deep fascia, that is flexor retinaculum. So the flexor retinaculum is a strong fibrous band which we can identify at the proximal part of the hand and the distal part of the forearm. Okay, it is a strong fibrous band which bridges the anterior concavity of carpus and converts it into an osseofibrous tunnel called as carpal tunnel for the passage of the flexor tendons. These are all the flexor tendons and the nerves and the vessels. They are all passing below this flexor retinaculum. The flexor retinaculum is rectangular. The shape of the flexor retinaculum is rectangular and is formed due to the thickening of the deep fascia in front of carpal bones. Yeah, let us see the attachments of the flexor retinaculum. So this flexor retinaculum, medially it is attached to pisiform bone proximally, and distally it is attaching to the hook of the hamate. Then coming to the lateral attachment of the flexor retinaculum, it is attaching proximally to the scaphoid bone and distally to the trapezium bone. Okay, these are the attachments of flexor retinaculum. Okay, so let us see that once again. So there's a proximal attachment at the medial aspect, that is pisiform bone, and here you can identify the distal attachment at the medial border, that is the hook of the hamate, and here you can see the scaphoid proximally, distally trapezium bone. Then coming to the proximally, it is blending with the antebrachial fascia, means the deep fascia of the forearm. Distally, it is blending with the palmar aponeurosis, the triangular fibrous sheet called as the palmar aponeurosis. So the coming to the proximal row, how it is attaching to this proximal row. So the proximal row means towards medial it is attaching to the pisiform bone, and laterally it is attaching to the tubercle of scaphoid. So here you can see that medial attachment at the medial part, we can identify the flexor retinaculum. It is going to divide into two slips. One is superficial slip and the deep slip. So the superficial slip is called as volar carpal ligament. And the distal part of the flexor retinaculum, here the laterally it is going to divide into two bands. So superficial slip and the deep slip, and this lateral attachment of flexor retinaculum distally it is going to attach to the trapezium bone. Then structures passing superficial to the flexor retinaculum, they are from medial to lateral ulnar nerve, ulnar artery, then palmar cutaneous branch of ulnar nerve, then tendon of palmaris longus, palmar cutaneous branch of median nerve, superficial branch, palmar branch of radial artery. These are all the structures which are running superficial to the flexor retinaculum. Let us see that. So from medial to lateral we have seen one is the ulnar artery, ulnar nerve, then we can identify the palmar cutaneous branch of ulnar nerve, then we can identify the tendon of palmaris longus, then palmar cutaneous branch of the median nerve, then most laterally we can identify superficial palmar branch of radial artery. Then structures passing deep to the flexor retinaculum. What are the structures passing deep to the flexor retinaculum? So under the under the flexor retinaculum, that space is called as carpal tunnel. Carpal tunnel. Through the carpal tunnel, we can identify tendons of flexor digitorum superficialis and tendons of flexor digitorum profundus, tendon of flexor pollicis longus, and the median nerve. These are the four structures passing beneath the flexor retinaculum. So carpal tunnel structures under the carpal tunnel, these four structures you have to remember: tendons of flexor digitorum superficialis, tendons of flexor digitorum profundus, tendon of flexor pollicis longus, and the median nerve. Okay, these the structures which we can identify in this diagram as well. So from lateral to medial we can identify flexor carpi radialis longus. Then below the flexor retinaculum, flexor pollicis longus tendon, then flexor digitorum superficialis and flexor digitorum profundus tendons. And most superficially, we can identify the median nerve. It is also passing under the carpal tunnel. It is also passing through the carpal tunnel. Yes, here it is also the same image I am showing you. The structures present beneath the flexor retinaculum, flexor digitorum superficialis tendons, and most laterally flexor pollicis longus. These four tendons, they are flexor digitorum profundus, and this yellow color one is nothing but the median nerve. Coming to the palmar aponeurosis. Palmar aponeurosis is a triangular shape modified part of the deep fascia. Modification of the deep fascia is this palmar aponeurosis. So the apex of palmar aponeurosis is blending with the palmaris longus tendon, and distally it is going to divide into two slips, and they are going to attach to the fibrous flexor sheaths. Okay, so that is about the palmar aponeurosis. So I'm going to explain about this palmar aponeurosis in a different class clearly. Then fibrous flexor sheaths of the fingers. What are the fibrous flexor sheaths we can identify? Let us discuss from palmar aspect to the dorsal aspect. So coming to the palmar aspect, we can identify flexor digitorum superficialis tendons. They are going to divide into two slips, and they are going to attach to the either side of the middle phalanx. And this flexor digitorum superficialis tendon, it is connected to the proximal phalanx by a fibrous flexor sheaths called as vinicula longa. Whereas the vinicula brevi, which is the fibrous sheet which is helping for the attachment of flexor digitorum profundus tendon to the middle phalanx, palmar aspect of the middle phalanx, and collateral ligaments between the either side of the proximal and the middle phalanx, and the middle and the distal phalanx we can identify. The collateral ligaments also we can identify. Then other sheets which we can identify on the dorsal aspect of the hand, which there are different bands of that. They are dorsal digital expansion. Okay, so about this dorsal digital expansion, I will explain you at the extensor compartment of forearm and the dorsum of the hand. So here you can see the palmar ligaments of interphalangeal joints. Here you can see that palmar ligaments of interphalangeal joints. This is the tendon of flexor digitorum profundus, and here you can see the annular ligaments and the cruciform parts. At the palmar aspect, you can identify. So this annular ligaments which are present at the palmar aspect, and the cruciform parts which are crossing the proximal and the middle phalanx, middle and the distal phalanx. So first, between the head of the metacarpal and the proximal phalanx, that is proximal cruciform ligament, then middle cruciform ligament which is present between proximal phalanx and the middle phalanx, and the distal cruciform part which is present between middle phalanx and the distal phalanx. Okay, these are nothing but cruciform ligaments. Then coming to the bursa. So coming to the bursa, there are two bursas are there, radial bursa and ulnar bursa. So the radial bursa, which is surrounding the flexor pollicis longus tendon. So flexor pollicis longus tendon. So if any infection is present in the flexor pollicis longus tendon towards laterally, that infection, it may descends down and enters into the thumb. And if any infection is present between the flexor digitorum superficialis or the flexor digitorum profundus at that area of the forearm, that infectious fluid, it descends down and reaches to the ulnar bursa and reaches to the little digit only. Why? Because index, middle and the ring fingers, they are having individual digital synovial sheaths. That is the region the infectious fluid, it does not cross the barrier and reaches to the index, middle and the ring fingers. It reaches only to the little finger. If any infectious fluid is present, if any infection is present in flexor digitorum profundus or the flexor digitorum superficialis tendons. So here you can see the ulnar bursa towards medially, towards laterally you can see the radial bursa as well. Then coming to the intrinsic muscles of the hand. Intrinsic muscles of the hand are arranged into 5 groups. One is thenar muscles, then adductor of the thumb, hypothenar muscles, lumbricals, and interossei. So these are all the muscles we are going to discuss. Okay, so let us explain. Let us discuss one by one. So coming to the thenar muscles, there are 3 thenar muscles are there: abductor pollicis brevis, flexor pollicis brevis, then opponens pollicis. Opponens pollicis. So coming to this abductor pollicis brevis and relationship, the relationship is abductor pollicis brevis is present most laterally, then flexor pollicis brevis is present most medially, then opponens pollicis is present deep to the above 2 muscles. So here you can see the abductor pollicis brevis, and here towards medially is flexor pollicis brevis, and underneath these 2 muscles we can identify the opponens pollicis brevis. Okay, flexor pollicis brevis, abductor pollicis brevis, and beneath that we can identify the opponens pollicis. This is nothing but the opponens pollicis brevis. The features are they form the thenar eminence of the palm of the hand. They are chiefly responsible for the opposition of the thumb. Opposition of the thumb means the touching the other digits tips, means with the help of the thumb if you touch the other digits distal phalanx, that is nothing but the opposition movement. So all of them are supplied by the recurrent branch of the median nerve. There's 3 muscles are supplied by a recurrent branch of median nerve. So let us see the three thenar muscles: abductor pollicis brevis, and then flexor pollicis brevis over here. Then here you can see the opponens pollicis. Opponens pollicis. So where they are getting inserted and all, we'll see that. So first one is the abductor pollicis brevis. So abductor pollicis brevis, which is arising from the scaphoid and the trapezium, and it is descending down. The tendon is getting inserted to. It is getting inserted to the lateral aspect of the proximal phalanx of the thumb. Proximal phalanx of the thumb. Whereas, here you can see that there is nothing but the origin and insertion of abductor pollicis brevis. And here you can see the flexor pollicis brevis, which is also arising from the trapezium bone, and it is reaching to the lateral aspect of the first metacarpal, which is present at the radial side. So numbering of the metacarpals is from lateral to medial. Remember, numbering is from lateral to medial. So first metacarpal lateral aspect gives insertion to the flexor pollicis brevis. Here let us see that abductor pollicis brevis, which is present here, and then here you can see the flexor pollicis brevis, which is present here. Okay, these are the 2 muscles of the thenar eminence. Other muscle is the opponens pollicis. Let me show you the opponens pollicis. So the opponens pollicis, it is also getting inserted to the lateral aspect of the first metacarpal. Okay, that is about these 3 thenar muscles. Then moving to the hypothenar muscles. So these hypothenar muscles, which are present proximal to the little finger. One is abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. So let us see that. So this is flexor digiti minimi. Here, yes, here you can see that these three hypothenar muscles. Okay, so flexor digiti minimi. First one is abductor digiti minimi, flexor digiti minimi, then opponens digiti minimi. So flexor digiti minimi, which is arising from the triquetral bone, and the flexor digiti abductor digiti minimi and the opponent's digiti minimi, they are rising from the hamate bone, and they are descending down, and they are reaching to the ulnar aspect of the first metacarpal and the ulnar aspect of the proximal phalanx. Relationship is abductor digiti minimi lies medially, abductor digiti minimi lies medially, flexor digiti minimi lies laterally. This is the flexor digiti minimi. This one is abductor digiti minimi, and opponent's digiti minimi lies deep to the above two muscles. Yeah, here you can see the opponent's digiti minimi muscle. So after separating these two, flexor and the abductor digiti minimi muscles, then we can identify the deep muscle is nothing but the opponent's digiti minimi. So these three muscles, they are forming the hypothenar eminence, as the three thenar muscles. In the same way, here this abductor digiti minimi, flexor digiti minimi, opponent's digiti minimi, they are forming the hypothenar eminence. So these three muscles are supplied by the deep branch of ulnar nerve, whereas here three thenar muscles are supplied by recurrent branch of median nerve. Hypothenar muscles are supplied by the deep branch of ulnar nerve. Yes, here also we can identify clearly the thenar muscles and the hypothenar muscles. Coming to the next muscle is adductor pollicis muscle. Okay, so this is adductor pollicis muscle. This muscle is a fan-shaped muscle, is located deep in the palm in contact with the metacarpals and the interossei. So it is consisting of two heads. One is oblique head and the transverse head. Let us see this oblique head and the transverse head. Oblique head, which is arising from trapezium bone, and the oblique head is going to join with the transverse head which is arising from the palmar aspect of the third metacarpal. So these two heads, they are going to join, and then this adductor pollicis which is getting inserted to the ulnar side of the proximal phalanx of the first digit. Okay, ulnar side of the proximal phalanx of the first digit. First digit is the thumb. Then yes, the nerve supply of this is nerve supply. It is supplied by the deep branch of ulnar nerve. Though the name it says adductor pollicis, but it is supplied by the deep branch of ulnar nerve, whereas the three thenar muscles are supplied by recurrent branch of median nerve. This adductor pollicis is supplied by deep branch of ulnar nerve. Then actions are adduction of the thumb to provide the power to the grip. So this is the muscle, nothing but adductor pollicis muscle. So this is the oblique head. Let me show you that oblique head. This is the oblique head, and this one is the transverse head of adductor pollicis. Then coming to the lumbricals, there are four lumbrical muscles are numbered first, second, third, and fourth from lateral to the medial. Okay, four lumbricals are there. From lateral to medial, we give the numbers 1, 2, 3, 4. They are very small, slender muscles, one for each digit. The name itself, lumbricals, means the worms, earthworms. Yes, origin of the lumbricals is by first and second lumbrical. Let me show you this. First and second lumbrical, they are unipinnate. Unipinnate, they arises from the lateral side of the flexor digitorum profundus tendons. Flexor digitorum profundus tendons. Whereas 3 and 4 lumbricals, they are bipinnate muscles. Bipinnate muscles, they are arising from the adjacent sides of the flexor digitorum profundus tendons. Okay. So this is first lumbrical, then this is second lumbrical, third lumbrical, and this is the fourth lumbrical. Then coming to the insertion of the lumbricals, the tendons cross the radial side of the metacarpopharyngeal joints to be inserted into the lateral side of the dorsal digital expansion of the corresponding digit from second to the fifth digits. So here you can see that they are running lateral to meet the dorsal digital expansion. The tendons of the lumbricals, they are running laterally and reaching to the dorsum aspect of the hand, and united with the extensor tendons and forms the dorsal digital expansion. Here you can see the lumbricals. So here, okay, these are nothing but the lumbricals. 1, 2, 3, and 4. So the nerve supply of the lumbricals, first and second lumbricals supplied by the median nerve, third and fourth lumbricals are supplied by the D branch of ulnar nerve. Well, lumbricals flex the metacarpophalangeal joints and extends the proximal and the distal interphalangeal joints. Okay, try to observe this one. So flexion at the metacarpophalangeal joint. Yes, here you can see that flexion of metacarpophalangeal joint and extension of interphalangeal joints. It is by the lumbricals. Then coming to the interossei muscles, the name itself it says that inter means between, ossei means the bone. The muscles which are present between the bones called as interossei muscles. So there are dorsal interossei and the palmar interossei. So let us see the interossei muscles. So the dorsal interossei muscles which are arising, dorsal interossei arising from the adjacent sides of the metacarpals means the first dorsal interossei arising from the first metacarpal and the second metacarpal means ulnar side of the first metacarpal, radial side of the second metacarpal, the first dorsal interossei is arising and the second dorsal interossei is arising from the adjacent sides of the second and third metacarpals. And third one is arising from the adjacent sides of third and fourth metacarpals, whereas the fourth one is arising from the fourth and fifth metacarpals, radial and ulnar side of the fourth and fifth metacarpal bones. These are nothing but the dorsal interossei. Whereas the palmar interossei, actually, these palmar interossei, they are unipinnate muscles. So first palmar interossei is arising from the ulnar side of the first metacarpal, and then the second palmar interossei is arising from the ulnar side of the second metacarpal. The third palmar interossei is arising from the radial side of fourth metacarpal, and the fourth palmar interossei is arising from the radial side of fifth metacarpal. So the third metacarpal, it is not giving any origin to the palmar interossei muscle. So all palmar interossei and the dorsal interossei are supplied by the D branch of ulnar nerve. So far we have seen 3 hypothenar muscles are supplied by the ulnar nerve, D branch of ulnar nerve. Adductor pollicis is also supplied by the ulnar nerve, D branch of ulnar nerve. Whereas lumbricals, first and second lumbrical, they are supplied by the median nerve. Third and fourth lumbricals, they are supplied by the D branch of ulnar nerve. Whereas the dorsal interossei, 4 dorsal interossei and 4 palmar interossei means 8 muscles. These are all supplied by the D branch of ulnar nerve. So that is about the muscles, intrinsic muscles of the hand. So thank you, my dear students. If you have any doubts, please contact me freely. Thank you.